First.
Recording in progress.
Got it. Okay. So, today's topic is ergonomics, and this is very common. We see a lot of patients here with the neck pain, back pain, and they are kind of a desk worker. So we want to make sure we cover this topic. So in that way, all our current patient, past patient, future patient, they can get access, and whoever is getting this recording, they can get the benefit out of it. And I try to make it a little bit more interesting to make sure people get engaged, because I know the information that is available right now is vast. So let's start with that. So I'm going to share my screen and let's start. All right. So as I say, today's topic is the ergonomics, and I'm going to be focusing more on the musculoskeletal conditions in it. And first thing it comes to the mind when I talk with anybody who's working on computer is that I got it covered, because I bought the best chair available in the market. I got the best desk. I have all those things, and yet still I have neck and back pain. So why? We'll figure it out. Okay. So if anybody feels that I got it covered, and if it still has pain, it doesn't mean that it's covered. Okay. All right. And these are some of the common things that we see. Like the first image you can see that it's more like looking at the computer, and when they receive the email, we look so closely, and it's like, you know, that it's gonna give you sore back, and it feels like, you know, you're going closer so you can understand better, but instead of that, you're just getting it worse. Okay. And the second picture is the typing, because a lot of people just crazy typing on the computer, and that does affect the wrist. So don't be a ninja. Okay. A ninja will just give you carpal tunnel. Okay. All right. So the third one is a lot of people think that, okay, just like, you know, going and circling around in the chair is the exercise. It's not Olympic sports. Okay. It may get you dizzy, but not gonna get you exercise. So let's start with that. Now, here are some of the statistics that, like, you know, it's very interesting topic around here. So statistic on the desk worker and musculoskeletal problems. 80% of the desk workers experience the back pain. And that's a really big number. 80% of the desk worker get a back pain. 30% workspace injuries are musculoskeletal. Okay. All right. I will make sure that people are mute, so in that way we don't hear it. Okay. All right. So 30% of the work injuries are musculoskeletal in a sense. That means, like, you know, that when people get injured on the workspace, that most of the time it is muscular. Okay. And 65% of the workers sits at the desk. So all the people who are working in US, 65% works on the desk. That number is really big. So those does affect the, like, you know, as you get older, it's going to affect you a lot in your posture, your back pain, your neck pain. And since COVID, I have personally noticed that the neck pain and back pain cases are increasing. I see a lot of patients in my clinic with the neck pain, and especially the mid back pain. You look around the thoracic, around the shoulder blade, because when you sit too long or when you don't follow the right ergonomics, you will end up with that kind of pain. Now, this is some statistic. 80% of people feel back pain. 70% of people feel neck pain. 10% experience the carpal tunnel, and 20% have the shoulder issues. So, but at some point, based on the statistic, I can tell that people who are working on the desk, 70 to 80% chance they're going to end up with some kind of musculoskeletal condition if they don't follow the right techniques. Okay, now this is, since there was a regulation in 1992, the Health and Safety Display Screen Equipment Regulation, that required every employer to put in implementation for the proper ergonomics, like providing the right desk, chair, computer. So in that way, they can reduce the amount of injuries happening at the workplace. But everybody knows that that's not true. Even though that like regulation is there, still all the injuries are on the rise. All the back, neck issues are on the rise, even though we have lots of technology, lots of information available in our fingertips. Still, people are experiencing lots of issues. So the desk-related pain is not only a desk issue. It's not only a workspace, because that's what people think. I have a lot of patients who I ask them, okay, how's your desk? And they say, perfect. I spent $1,000 on this and I made it perfect and it should be helping me. But why you're still having issue? So I categorize this to mainly three. My mistake, I said four main factors, but it's three, mainly three factors. Posture, I was thinking about four, and that's the reason that I said no, I'm going to include the posture in the habit, because posture is the habit. That poor posture is because of the poor habits. So I narrow it down to three main categories. The workspace, of course, it has to be right. Your habits, what's your daily habits makes a big difference, and your routine, what consistently you're doing it. So that makes a big difference. So let's start with the workspace. So nowadays, I know everybody knows about the height, the distance, and all those measurement, the checklist and everything, okay? But everybody has access to lots of information as well. So you can easily see what kind of desk you need, what kind of height you need, what kind of distance you need, what kind of screen you need. Yes, you have the access to that. Lots of videos are available for that. But also you have to consider the pre-existing conditions, because when you design your workspace, if somebody already has a back pain, and if they're designing their workspace, you have to consider that hey, I injured my back while playing golf. Then if you have a chronic issue, you have to consider that when you're designing your workspace. So that is the reason that customization is very, very important. So very common question I've been asked every time is that what kind of chair do I need for my workspace? Now, the answer is that you don't need proper brand or certain chair. You want chair that is adjustable with the height, with the length, with the armrest. All those things need to be adjustable. And once you get it, you need to adjust those things. So in that way, you can get the chair will customize to you, okay? The habits. So prolonged sitting is a habit, okay? You have to force yourself to come out of that habit, because when you sit for a long period of time, it does reduce your blood flow, okay? Our body needs circulation. So if you're not moving around, if you're just sitting, we got a problem, okay? Poor posture. So many times I see this one, they have a perfect position, workspace, but when the email comes, when they're in test, working on something, they're posture, they're leaning forward, their posture is not appropriate, and that does affect them with the poor hump back or forward head posture, rounded shoulder posture. That are very common postures because of the desk work. Prolonged same position can make some permanent changes in your posture. I came across one interesting topic one day, and that was very fascinating. This is not related to your workspace, but there was a new term called phone finger that I never heard about it. I know the text neck is very common because we're texting and your neck becomes like that, so text neck. But the phone finger is very interestingly, when you hold the phone, so most of the time what happened, your phone is resting on a little finger, okay, like this. So just compare your finger, both fingers like that, and see if you see any changes on the finger. Because if you're holding phone for a long period of time, you'll start feeling the changes in your finger. Same, this is new thing, but same with the prolonged same position. If you're humped back all the time when you're writing or something, eventually you're gonna start getting that hump back, Okay, if you're looking forward, if you're tensing and you're looking forward like that, all those muscles will develop in that position, and that is the reason at the end of the day you start feeling that, okay, I feel stressed, I feel tired. Think about it. 1/3 of your life you're sitting in that work chair. Make sure to adopt good posture. So roughly 8 to 9 hours people are working every day. We have 24 hours a day. So 8 hours is like 1/3 of the life you're spending there. So you better make it right, otherwise it's going to be a problem. So habit continues. So lack of ergonomics awareness. So even though information are available, but sometimes people don't trying to make changes because you're young, you're 30, 40, and you feel that, okay, nah, it's not going to affect me, and then you don't make any changes, and then you get a problem. A lack of movement break. Everybody knows that you cannot be on a screen for a long period of time. You have to take a break. So everybody knows this information, but are we following it? That's the question. Stress and tension, that's the big one, because I see this a lot, because I see a lot of IT people come here for neck and upper back pain, they say they have a deadline, they have to work on the project, and like, you know, I don't get the time to like relax, and then they're stressing out, they're tensed up, they're clenching their jaws, they're like, you know, really tensing the shoulder. That does affect. The stress can lead to a physical pain. So you need to be mindful of the stress. You can even do some breathing, relaxation technique in between, which is hard to practice because when you're working some like a high-end project and you had to take a break for a deep breathing, it doesn't sound good right now because no, I get to work, but you need that. If you don't do that, you're gonna have a problem, physical problem. So routine, the routine is sedentary lifestyle. So this is away from your life workspace. So 8 hours you're working, but most of the time when you're spending 8 hours on the chair, and the rest of the time, if you're not doing anything, we got a problem. So sedentary lifestyle is the biggest problem because when you're not even working the rest of the time, that does affect when you sit for 8 hours. Okay, repetitive task. If you're doing some activity over and over, like using a mouse over and over, can lead to the carpal tunnel. Any kind of activities that you're repeatedly doing it, that can lead to a problem. A lack of self-care practice. Okay, work over self-care habit that can lead to neglecting musculoskeletal health promoting behavior, including exercise, stretching, and relaxation. So as I mentioned, that self-care is very important. Focus on, like, you know, you need to do relaxation, you need to do the stretching, you need to do a cardio. So I tell people that every day, regardless of the age, every day you need to do stretching or some range of motion exercise. You need to do some weight training, and especially people around like 40 plus, you need to make sure you do the weight training that can affect your bone density and all those things. So you need to make sure you do stretching, range of motion, you do the strengthening, and you do some cardio. The amount, the intensity, you can decide based on your tolerance, but you can start slowly and you can incorporate those things in your routine. So after that, I get a common question about standing desk versus sitting desk. Which is better? What is best? So benefits of standing desk: it improves your posture, okay? It increases your energy and alertness. It burns more calorie, okay? And it reduces the risk of heart issues. Benefit of the sitting desk is comfort and stability, reduce the leg fatigue and concentration on the intensive task. When you're working something intensive on some project, and standing might not be a good idea. You wanted to sit down and focus on that. So which one is good? So sit to stand desk, the best of both worlds, okay? So you need to have the combination of sit to stand desk, okay? So one, flexibility and comfort. So you can switch it in between sitting and standing posture. There is a health benefit because, again, like, you know, you can mix and match, okay? Increased flexibility can lead to improved focus and productivity. So when you do that sit to stand combination desk, that helps a lot. Ergonomic chair versus exercise ball chair, because this also I get a lot of question that like, you know, that ball chair really helps with the back pain and like that. So it's like pineapple on pizza, debate of the office wall. Like, do we need a pineapple on pizza? Is it good? Some people like it, some people don't like it. So I think like, you know, pros tip is like exercise ball are great for core strength, but not so much for the business meetings, unless you're really into bouncing ideas around. So if you're really into like meeting a whole day long, might not be a good idea. Yes, it does help with your back, like, you know, if you work on it, but yeah, that's my opinion. That's my take. So I did email everybody this checklist, like, you know, so I'm not going to go over it. You should have the list. You need to make sure you do that, because I know, as I said, like a lot of people have this information. It's just putting in place is the issue. But everybody knows, just a few tips is like your lumbar support.
You got that.
Okay. Believe somebody.
Sorry.
Okay, no worries. Okay, so everybody knows that lumbar has to be supported, but you have a great lumbar support. You bought a nice expensive chair, but if you're not sitting back, or if you cannot type while you're sitting back, what are you going to do with that lumbar support? Okay. Armrest, it has to be enough that it's not shrugging your shoulder or it's not leaning for down. Okay. You need to make sure, like, you know, issue with the knee pain, like, you know, you need to make sure your legs are flat on the ground and the space between the edge of the chair and the back of the knee is about 4 fingers. You need to have those things done in order to make sure that you don't have an issue with the knee. So all those things, be mindful. Just you have it, like, you know, the list, make sure you go over it. Okay, so this is how usually ideally looks like. If you look at it, like, you know, the back support right here is properly supported. The all feet are nicely landed here. The angle at the knee is 90 degree. Here is perfectly aligned. If you notice, the arm is resting here. I do see one, like, you know, thing is like the arm is a little bit up. It depends on, like, you know, if you have issue with the carpal tunnel, you have to have that support as well. The mouse support. The screen, if you see, like, you know, it's kind of in alignment, but this is still a little bit low. So you need to make sure you work with this exact list. Okay. Now, this is my tips for the desk worker. So one, you have to have the proper workstation, ideal sit to stand desk. Then you have to follow 20-20-20 rules. So every 20 minutes, 20 feet away, 20 seconds. You wanted to look away 20 seconds, look away 20 feet away, okay? And every 20 minutes. So follow that 20-20 rules. I call it 5-glass water break morning. So basically, I want to make sure that, like, you know, that people get the water bottle and get the empty one and get the small one. Don't get the big one. Okay. Just get the small one, like a 1 cup. And every hour or so, take a break, go get the water. That's your time for your stretching. So it takes about 1 minute. In 1 minute, you can do 3 20-second exercise for your neck, for your back, or whatever you wanted to do. And in 8 hours, you can take 5 breaks. That's literally a 5-minute break all together in the whole day. If you're saying that you cannot spend 5 minutes on your health, we got a bigger issue. Okay, so it's just the prioritizing your health. Okay, daily 10,000 step target. When you're sitting all day long, the whole day you're sitting there, you need to make sure you take a time in the morning, in the evening, whenever you want to, you hit that 10,000 goal. Because if you hit the 10,000 goal, then you're really helping your body to recuperate after that 8 hours of sitting. Now, here's the daily stretching for the neck. So what I'm doing right now, as you can see, one is side bending, one is going forward and looking down, and the second is looking up and stretching on the other side. So we're working your trapezius, lever scapula, scalene. There are 3 different muscles in your neck. So you're stretching that. So think about it, 20 second, 20 second, 20 second. That's like 1 minute. So you can do it. So this is for the back. So if somebody has a back pain, you can just twist your back like this. You can lean forward. You're stretching your piriformis here, and just go on the side like this. This is for your upper back. You can stretch your pectoralis here. You can stretch your rhomboid, looking down, just pushing your hands forward, and put your hand on your table, and you can push your thoracic down. This is a basic exercise for your carpal tunnel. You can stretch your arm, shoulder, the wrist, prayer position, reverse prayer position, and just stretch your flexors. And this is what we do the custom deck assessment. So when we do the custom deck, like we have a software that we use to track the whole thing, like, what is the angle, how's the angle should be, and based on that, we can give a suggestion. And we do that remotely. So if somebody wants to check their, setup, the workstation, we can go for it. So we can exactly measure, the software does see exactly where the angle is. It does tell me exactly, what are the, what degree we're off. So in that way, we can fix it. We can see what we can do to help it to make it better. Now, how can we help with the custom program? So these are all the tips that you can do yourself, okay? But there are times that you wanted to make sure, you get the help. So most of the time, who's this for? Who actively having pain? So when we do the customization, if somebody has pain, they have a nice workspace, but you're still having issue, then yeah, you wanted to make sure, that you seek some help. You're doing stretching and exercise and everything, but still you're feeling pain. You're taking breaks, you're doing everything, but still you feel, okay, I have some pain going on in my neck, on shoulder, or something like that. Someone has a concern about the posture, you already feel that, okay, I'm looking I have a hump back, or I have forward head posture. And if you already have those issues, then yes, we need to work on that. Then you can definitely benefit from this program. What's included? So we do the remote monitoring, so we can make sure the custom desk assessment and recommendation for daily exercise program. So based on the posture and everything, we can design the exercise for a month, and you can do it every day, and you can see the difference. And you also get the access to the members area that we're working on, which has lots of information, nutritional part, and a lot of educational information that we can send it. And again, this one, I do it for education. All the seminars, I focus more on what you can do yourself. But if you need a help, then I'm here. And that's the reason that normally when people attend, or whoever signed up, they will get this deal. So normally we're doing $100 for designing the exercise, doing remote monitoring and assessing all those things. But if you're attending this, we'll just do it in $10. So if you are interested remotely, just text us or call us 469-212-8888 by Friday, and we can do this one. All right, so I try to cover very basic things, but very important things. So I wanted to make sure that people get the benefit of it. So if you have any question, concern, you can ask me. You can write in the chat box, and I can answer it. Anybody has any question? All right. Okay, so if you don't have a question, so I'll send you all the recording and everything probably tomorrow or Friday, and just take the advantage, because this is nothing, 10 bucks can, make a big difference in your posture and everything. So everybody, good night, and I will see you next month. If you guys have any topic that you want me to cover, send us an email at info@yourcarewellness.com, or text us or 469-212-8888. Probably next month, I am going to address the yoga, what not to do in yoga, because I know a lot of people has a back and neck pain, and they try to do yoga and they make it worse. So yoga is good for your back, neck pain, but if you not doing it right, then it can affect you. So I'm going to go over some of those topics that can really help you to be active, do yoga without any back and neck issue. All right, guys. So thank you so much. I will see you all next month. Just send us a message, and also send us an email, how did you like the presentation, if anything we can do to make it better or interesting, or what kind of topics you wanted to know. So thank you so much. All right. Thank you. Bye.